IVF, as we know, is a great scientific advancement. Since 1978, we've had about more than 5 million babies that have been born through IVF. However, there are a lot of still myths that are there in circulation around IVF, which I would like to bust today.
Press the bell icon on YouTube and don't miss another update.
People tend to think that IVF is not a natural process. If we understand the basic science behind it, the egg and the sperm fertilizes in the fallopian tube. The embryo grows there for about 3 to 5 days, then reaches the womb of the uterus of the mother, where the implantation happens, and we say that that's the pregnancy that's happened. In IVF, the same thing that happens in the fallopian tube, scientists have actually tried to mimic it outside the body, and therefore the only process that happens outside the body is that fertilization and the growth of the embryo outside the lab. And therefore we need to understand that IVF is only acting as a surrogate for the fallopian tube in women in which it is not working. Of course, it's now expanded to many other indications, but the rest, everything else happens inside our body, and therefore it's as natural. And that is what 40 years of science has also taught us, that the babies are as natural and as healthy as babies born through spontaneous conception. People think, oh, IVF is an extremely painful procedure. Again, IVF, as we understand, is entailing 2 weeks of injections. Now that's something that we don't have a shortcut for so far. Maybe science will develop some medicines for it, but so far we don't. And therefore we have to give the woman some injections so that we can get multiple eggs that need to be harvested. And that actually is the only painful part of the IVF journey, because you need to take injections. The injections are as painful as any of the vaccines or any other injections that are administered to us. Once these eggs are ready, then they are taken out from the body through a very small procedure which is known as the egg retrieval procedure, and it is done under either anesthesia or mild sedation, so you don't really feel anything. And the next important step in an IVF is when the embryo implantation process, which is putting the embryo back into the mother's womb. And it is much like an IUI or a simple procedure wherein a plastic cannula, through that an embryo is delivered inside the uterus, typically done without any anesthesia because it's not a painful procedure. Another myth that we have around IVF is that it always results in multiple pregnancy. The chances are more than a natural conception, and that's because you tend to put back 2 or 3 embryos to try and increase the chance of pregnancy. The overall risk of having a multiple pregnancy or twins or higher is about 10%. So because everything in an IVF happens outside the body, if you put only 1 embryo back, which is a concept known as single embryo transfer, your chances of twins are actually minimized. It's just that it's also offset by about a 10% decrease in the success rate, but it's very much controlled. If you think you do not want to take the risk of multiple pregnancy at any cost, then that's what you should be planning. You can freeze the extra embryos and keep doing single embryo transfers, but your chance of twins is very much minimized. People ask me that if I conceive one baby through IVF, will I never be able to have children of my own naturally? It's quite the other way around, because a lot of patients we've seen who conceive with difficulty in the first attempt may even require an IVF for any condition ranging from unexplained infertility, endometriosis or PCOS, might actually conceive naturally the next time, probably because there are some changes that the body undergoes post-pregnancy, probably because the stress or the social pressure that is there on the woman is no longer there. So surprisingly, you actually see that a lot of women might actually conceive easier on the next time around than through an IVF. But IVF in no way hinders them in trying to procreate on their own naturally the next time. Fifth, again, there is a myth that there are the abnormalities of the high risk of abnormalities or high risk of miscarriages happen in IVF. Again, we have very, very clear-cut documented research. Now we have 40 years. Our own first IVF baby, who was Louis Brown, born in 1978, who herself has had natural pregnancies also. And therefore, and a full literature of 40 years have taught us that the risk of abnormalities or the risk of miscarriage in an IVF conception is no higher than any other spontaneous conception. For people who've been trying for innumerable number of years, 15, 20 years, IVF has come as a boon where it can actually help you get as high as a 60-70% chance in that particular cycle to get pregnant. Time is of big essence in IVF because the woman's age is a very important criteria, and therefore make a decision and go ahead with it if you really have to, because IVF overall is a very safe science.